Good morning. Today I'm going to talk about psychological burnout in the nursing field. So according to the Journal of Advanced Nursing Research, psychological burnout can be defined as a multidimensional syndrome which is influenced by three different factors. These factors include depersonalization, so when a person develops negative feelings towards their workplace and possibly towards their patients, as well as emotional exhaustion. Someone's mentally drained, they're tired, they cannot cope with their workload, as well as a lack of self-accomplishment. So nurses feel like they're not completing their work, they can't reflect on their work in a positive manner, and they're not motivated to do better. A study conducted by the Monash University among A&MF members found that 38% of nurses were experiencing burnout. 44% of nurses said that they felt their work was undervalued and they had a lack of self-achievement. So as previously described, the lack of achievement is an influencing factor in burnout. So these nurses are at risk of burning out, or they might be even experiencing burnout at the moment. An study conducted by the Australian Journal of Advanced Nursing also found that among Victorian nurses, the more experienced the nurse, the less likely they were to experience burnout. This was explained as if a nurse found themselves in a stressful or a new situation, if they had more experience, more skills and knowledge, they could cope in that situation, whereas nurses who were new, or graduate nurses who did not have that experience or skills, were going to be more stressed in those situations because they didn't have what they needed to equip them to cope in those situations. So burnout does not just affect the individual, it also affects the patients and the colleagues. So according to the Western Journal of Nursing Research, it actually found that nurses who were experiencing burnout were making poorer decisions. So they were not making the decisions best to their ability for patient care, so patients are put at risk. Also, nurses who were burnt out were creating more medical errors and were not recognising these errors. So patient might get the wrong medication. It's pretty significant danger to the patient if the nurse is making more medical errors and cannot recognise his medical errors. Also, if an individual calls in sick because they're feeling burnout, their colleagues have a higher workload and the colleagues are not going to provide the highest quality care to their patients because of this higher workload. So what can be done to prevent burnout in nursing? A study conducted by Applied Nursing Research Journal found that strategies that enhance mindfulness and relaxation actually decrease burnout in nurses. So hospitals could encourage these practices or more support systems so that nurses feel like their work is valued, and nurses are encouraged to undertake relaxation or mindfulness and hopefully decrease that burnout. As well as hospitals providing more education and training days so that nurses are equipped with the experience and skills to cope with most stressful situations and new situations to decrease stress experienced. Also, higher staffing levels, not always achievable, but if possible, would help with lowering work demand on nurses, lowering their stress and allowing patients to receive the highest quality care. So that is psychological burnout, and thank you for listening.